It's been 4 days. Tell me how you feel.
Much better. My face and jaw, all the way down through here and into my neck, just a lot more relaxed.
Yeah.
That I guess I wasn't really realizing how tight it was before.
Sure.
I always had tightness kind of in the back of my neck, but I didn't realize how much it had been coming around to the front and even down into my shoulders. And I've slept better. I haven't been waking up with headaches in the nighttime.
So that's profoundly different, right?
Yes, and I'm counting the days. I just hope it continues and I don't have that problem anymore.
Yeah.
But yes, I haven't had as much discomfort even when I do wake up in the mornings.
Yeah.
And the tightness there that I just didn't realize how much I had before. Sensitivity, next to nothing now.
The cold thing.
Yes.
And that's huge, right?
Yeah, that's big. And that's something connected that I didn't make that connection before.
Yeah.
With the dental stuff and all. I just thought that was something that,
Like your other dentist said, it's like an aging process, right?
Yes, the aging thing, and it was going to be normal. So
you're my age. We're not old.
This is not that old yet, but the sensitivity. I just never made all that connection before, and now it's just, when one little thing, like when sinuses act up or whatever,
sure.
I know what that is, and it's separate.
Yeah.
Than this. So
so move
my mouth feels better.
Your neck around.
Oh yeah.
Much looser, right?
Much looser. And even then, like I said, if I have tight spots, I can stretch them out. It's relaxed enough that I can work it. I can't. It's not before. It was so tight and so tense everywhere. It's like nothing could relax.
Right.
So it's totally different. I can feel it all through my face. I mean, forehead, down the sides of my face, especially because I had a lot of tension, like from my temples down.
Gone.
Had some. A lot going on the past few days and a lot of traveling, sitting, working on my feet, all day long. So a lot of a lot of opportunities for more tension than normally I would
teacher,
be.
Right?
We had a lot of lab work and stuff in the classroom, but just a lot of go and that would have caused me to be taking lots of tension headache medicine or something, and I haven't. I just haven't had to take any, so.
Are you
Very
glad
happy about that.
You had it done?
Oh, yes.
Yeah.
Yes, and honestly, I watched the YouTube videos, I saw everybody else, and then you think, okay, they have a lot of the symptoms that I do, but is it going to work for me? And I did have doubts. I mean, I just hoped and prayed that it would, I would see a significant difference and just help me get through it, and yes, I'm very glad I did.
Awesome.
Yeah, because I've even been going through saying, oh, wow, this does feel different. I can't believe it. I didn't, things that I didn't realize would feel different do.
Yeah.
Okay.
So tell me why you're here and what's going on.
Okay, I've had headaches, migraines actually getting worse. They usually come up in the mornings, early morning hours, like between 2 and 5-ish, something like that. I wake up with them. If I don't get them stopped, then full-fledged migraine. So I've missed a lot of days of school because of it.
And you're a teacher?
I'm a teacher, yeah.
Right.
But I've just noticed the pattern getting worse. I had already gone to my dentist and gotten a mouth guard for nighttime use.
What did it do,
so,
if anything?
Not really anything.
Did it help or hurt or neutral?
Pretty neutral. I really kind of just keep wearing it because I feel like maybe it'll protect my teeth more than anything.
Yeah.
I know that I clench my teeth and jaws at times of stress, or I know I do it at night. I used to grind my teeth whenever I was little at night.
Sure.
So, anyway, I just need to get the headaches stopped is the main thing.
Yeah, and can you point to where the headaches, where you feel them?
Yeah, I usually get them right up the sides of my head. I've had them sometimes at night whenever I get up, they're in my sinus area, it feels like.
Right.
But I've not had sinus infections or anything like that. When I go to the doctor, I'm usually good.
Okay. Have you been in ENT? Have they looked at the ears or any of that?
Yes. As a matter of fact, the past year, I've kind of had some sharp pains in my ear, mostly in my left. And so I went to the doctor about it first, and they sent me to an ENT, and they did all the audiology tests, and everything was good. And they said I didn't have anything wrong, and they said I needed to go to TMJ specialist, is what they told me, and that I was misdiagnosed, I guess, in there. So I really didn't follow through with that. Went to my regular dentist and got all the other work done, and then my ear is still bothering me really bad this past couple or 3 months. And so I went back, they sent me back to ENT.
Yeah.
Same thing. He told me the same thing. No, it's not. They told me this time I had fluid in my ear, but the ENT said no, don't have fluid in my ear. It's not that. It's all related to the TMJ stuff. So
Okay.
I was very frustrated, to say the least, and they were going to send me on to an oral surgeon, and that's whenever I found out about your office headache stuff. I've been on preventative medication that they gave me for it, and it hasn't done any good for the migraines.
For the migraines.
Yeah.
And like Imitrex, something like that? Do you remember?
I think, was there a Maltrax or something like that? There was some dissolvable
Understood.
thing that I take for my migraines whenever they're coming on. I don't remember the name of the
It's okay, but it
other
didn't help.
medication. No, I didn't notice it helping. I was still waking up with headaches and still having them. So
What about like ibuprofen or Tylenol, something like an
I took
anti-inflammatory?
that on a regular basis. I would take ibuprofen when that would help, and I would take. I got to where I was taking like the Tylenol tension headache, so that would help in the early stages somewhat.
Okay.
Kind of maybe keep it from getting much worse.
Okay. Are your teeth sensitive to cold?
Yes, I noticed teeth sensitivity and also movement. Like I noticed that my teeth were really sore in certain areas.
Sure.
Like flossing, couldn't do that.
Because
Sensitive, bleed and hurt really bad whenever I go between the teeth and stuff. Just in that area though. I mean, it was just kind of in these areas right here.
Yeah.
And it wasn't toward the back, the front, everything else was fine. But it was those areas. And so I told my regular dentist about it, and they said, oh, you have some movement, and probably you're getting older and all that other stuff, and your teeth will move and stuff. So, no. But
did
yeah, I've
they check you
noticed
for
it's
periodontal
different.
disease? Did they probe and look diligently for that?
Well, I had a good cleaning and checkup and x-rays, so,
You would assume.
Yeah, I would assume they did.
Yeah.
Yeah, but I mean, they told me pretty much my teeth were fine. It was just old age, I guess. I don't know.
Yeah.
Just
You're not old.
I didn't think I was that old.
You're not.
So.
Okay. So you found us. How did you find us?
YouTube. I was
Yeah.
actually looking up topics on TMJ and dentists who would work with us, on
Sure.
finding an answer for this and stuff. And so your video popped up.
Of all
and
places, right?
Then I saw a girl on there who had come from a long ways away, and she was talking about the same symptoms, just neck and tension and coming up and, having the headaches. And
Yeah.
so.
Are you tense
Always.
in the neck and
Always.
shoulders?
Yes, always.
Can you move left and right, or is it?
I
uncomfortable?
can, but it's get to a certain point and it's uncomfortable. It's just tight all the time. I'm constantly stretching my neck. I've done massage therapy. I've done
Yeah.
chiropractor for a long time, just to kind of help and
To no avail.
get everything adjusted. I just have to keep going back. I mean, it
Well, they love
eases
that.
it and it feels good, but I'm there constantly. Yeah,
They love
right,
that.
right. And it does feel good. It does help, but it doesn't. It's never stopped. I mean, it's just a continuous thing I have to do.
All right. Well,
Now if you would clench as hard as you can, open big, clench as hard as you can, and open big.
bite home hard. To the left. And open. To do one of these. So.
Feels like they're going down together straight.
Things are a little more even now, right?
Yeah.
A little more balanced. We'll just,
I can definitely notice a difference
Yeah.
in the front even, and that's not where I was expecting.
it's gonna start, things are gonna start hitting her to the front as we go. So don't let that scare you, that's normal, okay? Bite home really hard, and now go, and open, that was perfect. That was an excellent
That
bite.
felt a lot different than the other time.
Yeah.
Feels like my back teeth are coming together like they haven't done before.
Like everything's a little more even?
Yeah, front to back evenness.
Gotcha. Let me check something. Relax. What's he like?
I barely feel anything.
Almost nothing? What's he like?
No pain.
No pain whatsoever, right?
No.
Let me check one last time on this guy.
I really feel hardly anything.
So he's almost
It's-
gone.
yeah,
So it's profoundly better than it was back 30 minutes
Yeah,
ago.
because I could feel a little bit uncomfortable. Now it's
Now it's no big
no.
deal.
I mean, I have to really think about it.
Do me a
to
favor.
see.
Move your neck around. Does it feel any different? Get a cube for me. We're not done yet, but I want to check.
Feels
Nice
like
cube.
down the sides of my head.
Yeah.
Just kind of feel this wave, like a lot.
Feels good? Feels bad?
No, it feels better. I just feel like this. I can feel it.
Yeah, sorry.
That makes sense. I haven't.
Do me a favor, real quick. We're not done yet, but I want to check. Go ahead and switch that. Good 5 seconds. 0 to 10.
Like a 2,
And
if even that.
If even that. So 1 or 2.
This one on the
And
bottom.
you were a 5, yeah. See, it's already working.
Yeah, because earlier it was whole mouth, and that I really had to think about where, if any.
So that was
sensitive.
almost not bad, right?
No, not at all.
Yeah, see, we're already getting
And
there.
I just put some water in my mouth first thing in the lobby when I came in, and
Yeah.
it was.
Yeah, that was sensitive?
Yeah.
Just out of the...
It was sensitive.
And that didn't even have ice in it.
Yeah, true. It was cold, but it was
Yeah.
not ice water.
This is the cure for sensitive teeth, too, by the way. What's it feel like?
I don't know how to describe it. I'm sitting here feeling how I can finally start to feel the back teeth together
I know, right?
at the same time that the front teeth are.
What's your face feel like?
Tired.
Relaxed,
Kinda
tired?
Yeah.
Kind of sleepy?
Yeah, like under my eyes.
Yeah. Kind of loose.
Around
Is
that
that fair?
area. Yeah.
Relaxed, sleepy, loose?
Not
Not tense?
like my jaw's back here above my jaw by my ear. Usually just always tight.
What's it like now?
I don't even feel it. I don't even notice it really.
Good. Give her eyes. Switch it again. What is it? 0 to 10?
0.
Nothing.
Nothing.
No big deal.
No big
You know,
deal.
the reason you're having trouble going left and right is because you were so wound up. You know,
Yeah,
I don't know if
I
you
believe
realize,
that.
but the lateral pterygoid muscle between your skull and your jawbone here, there's that little cartilage, the disc you saw it on the 3D
Mm-hmm.
imaging. Well, when you open a lot, you're open for a sec. That muscle pulls that cartilage forwards on the skull, now close, and it lets go and it pulls it back. Remember you were going about the ear thing?
Yeah.
This guy was all wound up and tight. So you were having an easier time going this way because this guy wasn't as wound up as this guy.
Right.
And this guy
Which is
was where
why
the
on
ear
that
was.
side, and when I'd have headaches, I think 99% of the time, I know 99% of the time it was on this side.
Yeah. Well, that
Totally
would be
left side.
that would be left temporalis giving you that temporal headache. So and now the data is showing me it's shut down. It's working a little bit like it's supposed to going left, but you know this is good stuff.
My jaw is. I know I could never shut my mouth. I've been noticing since I saw you and thinking more about it.
Mm-hmm.
Whenever I would shut my mouth, it wouldn't go straight down like that.
Yeah.
It would move and then go out,
Yeah.
or my jaw just would feel like it was going everywhere.
But now everything just feels.
Yeah, I just
natural?
shut my mouth.
How's your
I
pop
think
click
it's going
thing?
straight down, right?
It looks like
Feels
it.
like it.
Yeah.
It's not really moving around.
It's going to take you about a month to get used to this. It's going to weird you out for about a week. And then about 10 days from now, it'll be like, okay. And then a month from now, it'll be like, you don't even remember this.
Yeah.
Yeah, that's
I hope.
typical. Yeah. And the headache thing, if it's only the bite that was causing your headaches, it will be gone.
Okay.
Headaches are weird because you can have hormonal issues, vascular, you know. If it's a little bit of that mixed in with it, they're still going to be there, but probably
Yeah.
lesser. Because usually the bite's part of it.
It literally feels like when I take a drink,
Yeah.
it almost feels like my teeth have some kind of seal on them that's not even affected. Like it doesn't even. I don't understand. My jaw just feels like it is totally set back. Like it feels like it's backward.
Just relax.
That's weird. Yeah, I mean, I really feel like my jaw has been adjusted. Does that make sense? Like
It's
it's
permanent.
been like cracked adjusted in there. It's not. It was so. I didn't think it would fit back in
It
there. I
was
was really
bracing.
concerned about that. To the front, and it's amazing. I
Made a big
haven't
difference,
had
yeah.
it. Yes, and I haven't had a headache. Nothing like that I'd had before. So I
One
just
second.
going day by day.